Malawi Brief.
Mawawu ku nyumba ya malamulo kunayambika ndi nkhani yokhuzana kujomba kwa aphungu mu nyumbayi m'malo mwa aphungu 226 amene anapezeka mnyumbayi ndi aphungu 78. Izi zinapangisa kuti a Deputy Speaker athe kukumbutsa aphunguwa za ntchito yawo, ndipo kumbali ya nduna a Deputy Speaker ayamikira chifukwa chozipereka pa ntchito yawo pamene zaonetsanso lero kuti mnyumbayi nduna zikumabwera mozipereka.
It's still my worry that majority of our members are deliberately not looking at their clocks, at their time, and they choose to come in the house at any time they feel like it's appropriate to them. It's not looking good on our members. I wanted to congratulate ministers. The attendance for ministers this morning is very good. And when things are done, we have to say congratulations to the ministers, because we have more than half of the cabinet in the house. And we have two leaders in the opposition Malawi Congress Party. The backbencher leader is here, and 3 other honorable members. We have 3 in the UTM. At least congratulations, because that's almost 50% of your number. The independence is maybe 2% is available. The independence in the opposition, only 2% available, because I can only see Chitipa North and the honorable member for Dowa South is available in the House. Leader, I see you rising on a private member's day. Is it to welcome to? Oh, you are a member of parliament. Leader, you have the floor. It's good to see you this morning, leader. You are a member of parliament, leader, but not a backbencher, leader. But it's good to see you on a private member's day. Thank you very much, leader. You have the floor, leader. Leader was rising to be seen. Actually, the leader is in the house this morning as a member of parliament for the honorable colleagues and the people of Rumpi North. And we see the honorable Minister of Justice in the house. All the deputy ministers are here. The honorable Minister of Agriculture, and the honorable Minister of Finance, the honorable Minister for Health, Gender, Labor, the Deputy Minister of Education, Trade, Natural Resource. I actually know all the portfolios. And the Deputy Minister of Gender. This side, we see the arrival of Honorable Member Commissioner Chitonya for Karonga City. Honorable members, the attendance this morning favors the government side, and I pray the questions we're going to start tackling, we will definitely going to get the members in the house. It's not looking good. Those that have submitted their constituency statements, can we also be ready today so that we deal with these constituency statements so that we don't have to look at them again next week. And I don't know if since we started, if we have used our gadgets for the attendance, but possibly a quick roll call would be better to know who is in the house. I can see up to this level where Cholo Tekeran is, but I cannot see further. So I might include my staff at the back as members of parliament. So a roll call would help us to get who is in the house. And those that are in the lobby, please rush. We're going to be having a roll call. Honourable members, I know Kadabe Centre wanted to request for the same, and the Kadabe Centre was that what is the out of order, sir?
Yes, first speaker, sir. Today being a private members' day, I was rising to propose for the same honourable first speaker, sir. since the government front bench is full, but look at our colleagues, they are late or they are absent. So a proposal for a roll call, Mr. Fetusika, sir. Thank you.
To give a summary, that at signing in this morning, only 78 members of parliament were in the House. 78 members of parliament were in the House out of the 226. And 2 honor members have no gadgets. We've included them on the signed in. So 78 members were present in the House. So we will proceed with business, and I will recognize the point of order from the people of Blantyre City Misesa, Sochi constituency. What has gone out of order before we continue with business?
Thank you very much, First Deputy Speaker. Order to record the Blantyre City Jijiri Misesa as absent while he's rightly sitting on his seat. I would like to register that the Blantyre City Jijiri Misesa is in the House to represent the people of Blantyre City Jijiri Misesa.
Thank you. Thank you very much, Honourable Member. As you are aware, our starting time for business for this House is 9:30, and we could have chosen 7:30, 8:30, but we decided to choose 9:30 to allow members of the cabinet to visit their offices for immediate works before they arrive here. And considering that, honorable colleagues, you are not provided by parliamentary accommodation, you are not coming from one position. We know some drive as far as Salima, every day, Kasungu, Deza, every day, Chinji. So we accommodated you. You have time to arrive here. 9:30, only 78 members were in this House. So those that were not here, it doesn't mean that you are absent, honorable member. You are here, but you were late. You were very late to report for work. And very, very late. I hope you will consider coming on time next time you come to this House. And all procedures of this House, according to our own standing orders, will be implemented on you, honorable member, Blantyre Jijiri Misesa. All procedures will be implemented on you today. So you appreciate the advantages of coming in late to work. Thank you very much. I therefore rule.
And through you, let me thank the honorable member for Kasungu Central for his question, which is to ask my ministry when the ministry plans to officially open the Gogode maternity wing and provide the necessary utilities, and whether the ministry is aware of theft of materials previously supplied by Gogode at Gogode Clinic. Mr. First Deputy Speaker, sir, let me commend the honorable member for his interest in improving access to health services. My ministry is aware that the maternity wing at Gogode Clinic requires medical equipment and medical furniture to facilitate its opening. Mr. First Deputy Speaker, sir, my ministry will leverage on availability of 5 billion constituency development fund that has been allocated to Kasungu Central constituency to purchase the equipment and accessories for the maternity wing. Mr. First Deputy Speaker, sir, I therefore would like to request the honorable member to prioritize Gogode maternity wing in the CDF plan, so that part of the CDF should be used to purchase medical equipment and other accessories for Gogode maternity wing to expedite its opening. My ministry will therefore officially open the facility once it is fully equipped. Mr. First Deputy Speaker, sir, as for the issue of theft of materials at Gogode Clinic, my ministry is working in collaboration with the Director of Health Services for Kasungu to investigate the theft issue and bring the culprits to book. Therefore, I'll be able to share the findings with the honorable member as soon as investigations are concluded. I thank you, Mr. First Deputy Speaker.
Thank you, Honourable Minister, for the feedback. I will, honourable members, you cannot just rise to say point of order. You know the procedure. Okay. What has gone out of order? Honourable member for the Zakasina.
Good morning, First Deputy Speaker. Is it in order that our beloved ministers, when they are referring to CDF, they keep referring it as 5 billion, when we know it's not 5 billion? Because out of 5 billion, the councils have taken their share. Some are taking some percentages to construct DC's office, DC's house, and what. So can we say it's 3 billion? In actual sense, it's 3 billion. The actual sense is 3 billion, which is going to constituency. 2 billion is staying at the council. So is it in order that the ministers should keep referring 5 billion going to a constituency when it's only 3 billion going into constituency?
Honourable member, thank you very much. Honourable member, thank you very much. You have addressed a point of order to my office. Let me respond. Order, honourable members, order. Order to my right. Order to my left. Order. Honourable members, a point of order is addressed to the chair, and the chair seated this morning is the First Deputy Speaker of Parliament, and this is my response to the point of order. Honourable member, government has decentralized 5 billion kwacha. That 5 billion has gone for decentralization under the CDF projects, but the guidelines as approved, as seen and approved by this House, requires us to allocate those funds according to the guidelines. So whatever ends up into your constituency, it has gone to your district council, it has gone through bursaries, it has gone through a lot of other issues in your constituency. So we still call it 5 billion kwacha constituency development fund. Thank you very much. So I rule you out of order, honourable member. Supplementary, the owner of the question. Let's get you connected, owner of the question. And then in Cheu Central, we will add you back, but I've recognized you. The owner of the question needs to be highlighted. Please request for a microphone. You have. For the first supplementary question, sir, you have the floor.
Thank you so much, First Deputy. Thank you so much, thanks, Deputy Speaker, for recognizing again the people of Kasungu Central on a supplementary question. First of all, I'd like to appreciate the able minister for her response to the question of the people of Kasungu Central. Before I ask the supplementary question, I just want to remind the Honorable Minister of Health that today is exactly 8 months, 24 days, 44 minutes. Exactly, she promised the people of Gogode that she would visit. This is a house of records. She stood over there and said she will visit. 9 months later, she didn't visit. She doesn't pick calls on the matter. And when we raised this issue of Gogode, that time we were assured that government will look into the matter. We appreciate the policy direction, the decentralization that has been alluded to, that we need to prioritize the Gogode hospital. We've done that. We've wasted 9 months because we were waiting on her. We have prioritized that, but at our council now, the funds are not yet there. We appreciate the people of Gogode would like to just know if you are still visiting or they should forget that you are visiting them. Thank you so much. I submit.
Honourable member, next time you raise a supplementary question, please avoid referring to the minister in person, because the visit can be the ministry can be the minister. So if you refer to her in person, she doesn't carry the ministry everywhere she goes. The ministry continues even while she's here. She is only the minister of health, not the ministry of health. Thank you very much, I rule you. The second supplementary question is for, I did recognize the honour member for Nchewu. We will deal with the Nkatabe West. Nkatabe West, you have the floor to create space for the honourable member for Nchewu. Nkatabe West, where are you standing? Oh, please, you have the floor. Oh, you switched yourself off. Nkatabe Central. You have the floor, sir. You have the floor.
Thank you, Right Honorable First Deputy Speaker, sir. I just want to ask the supplementary question or to bring the attention to the Minister of Health. We got Chesam Health Facility. As I'm talking, I was informed that the health workers, they are suspending their works because they can't work. They don't have water. Luckily, during the colonial era, we had water tanks there. They are there. But all we're asking, if there can be any provision of water system, whether it's borehole or submerged pumps, we will appreciate from the minister. Otherwise, there is no any health worker who can work without water. How can they treat the patients? So we are appealing to the minister if they can assist with water at the moment while we are budgeting for the CDF money. Thank you, Minister.
Thank you very much. The people of Nkatabe West. We are still trying to create space for the honorable member for Nchewu. Was that Nchewu Central West or Nchewu? What constituency is that, sir? You have the floor for a supplementary question.
Thank you very much, Rat, First Deputy Speaker, for recognizing the people of Nchewu Central East to ask the Minister of Health to consider upgrading Birira Health Center to a rural hospital. The honorable member from Nchewu Central East is asking the minister to upgrade this Birira Health Center to a rural hospital just because there are a lot of women, the population is densely populated, and the Nchewu District Hospital is in the peripheral area, about 70 kilometers away from Birira Health Center. So if we have maternal complications, it becomes very difficult to transport these ladies to Nchewu District Hospital. Thank you, First Deputy Speaker.
Thank you. I will take the honorable member from Nsanje Central for the last supplementary question.
Thank you very much, First Deputy Speaker, sir, for recognizing the people of Nsanje Central to provide or to give a supplementary question. First Deputy Speaker, the people of Nsanje Central would like to ask the Minister of Health to consider increasing the budgetary allocation for Nsanje DHO because of two reasons. One, that all the referrals from Nsanje are supposed to go to Queen Elizabeth Central Hospital, which is about 250 kilometers away. And we are spending a lot of money to support the DHO transport our patients, more especially emergency patients. Just one trip, you are spending closer to 500,000. So even an MP to support, it is becoming a huge challenge. Secondly, it's because as a hospital, Nsanje also supports our brothers and sisters from Mozambique. It's a huge population, but when the budgetary allocations are being provided, the population that is taken into consideration is only that of Nsanje as a district. But in fact, in true sense, the DHO supports a huge population if you consider the people that are coming from Mozambique, because we support them as our brothers and sisters. Therefore, can the minister consider increasing the budgetary allocation for the DHO, more especially for fuel? As I'm speaking, we are struggling. We are supporting the DHO, but we cannot continue doing that because it's really very expensive. I thank you, Mr. First Deputy Speaker, sir.
Thank you, Honorable Minister, for those questions.
Thank you so much, Mr. First Deputy Speaker. And through you, let me thank the owner of the original question, the honorable member for Kasungu Central. I understand his concern for Gogode Health Center. My advice to honorable members of the House is to accept the reality and changes that are happening. The President of Malawi, Professor Arthur Peter Mutharika, has given us the powers to prioritize development activities within our constituencies and also at the council level. And currently, as the processes are happening, I'm advising the honorable member to prioritize equipments that are needed for this health center under the CDF, so that the people of Kasungu Central can have this health center functional, and my ministry, as I've advised, is ready and willing to come and open the health facility. Thank you. I would also like to thank the honorable member from Nkatabe West for his supplementary question on the issue of water at a facility in Nkatabe West that I didn't capture properly. I would like to advise the honorable member that my ministry has taken note of the water challenge at the facility. However, at district level, I'm advising him to take it up with the ministry responsible for water, just to make sure that there is a proper water allocation at the facility, and the people of Nkatabe West should be assisted under this health facility. Mr. First Deputy Speaker, I would also like to thank the honorable member for Ncheu Central East, who has asked my ministry to consider upgrading Bilira Health Center to a rural hospital. Mr. First Deputy Speaker, once all assessments are conducted, indeed to assess if Bilira Health Center has enough space, if Bilira Health Center is surrounded by other facilities that can benefit from the community hospital, and if Bilira can be able to accommodate several houses and the equipments and everything else that is required for a rural hospital, my ministry will ensure that we actively look for resources to ensure that Bilira Health Center is upgraded to a rural hospital. I would also like to thank Nsanje Central for asking my ministry to consider increasing budget allocation for Nsanje DHO. Thank you so much for this request to my ministry. This has been noted and it will be looked into, especially during mid-year review. Thank you, Mr. First Deputy Speaker.
Thank you very much. So the honourable member from Nkatabe West, please liaise with the council and the honourable Minister of Water Sanitation for your question to be responded to. And I think that's the direction that has been given. We go to question number 153. The honourable member for Ncheu Zonzi Mvai. The honourable member for Ncheu Zonzi Mvai, please request for a microphone if you are in the house. You have the floor. Is the honourable member in the house? The honourable member for Ncheu Dzozimvai is not in the house. We go to the honourable question 154. The honourable member from Zimba South West. Honourable member from Zimba South West, you will be accommodated on the gadget very soon. Please request. You have the floor.
Thank you very much, First Deputy Speaker. Indeed, this question is mine. Thank you.
When a senior member confirms a question like that, the chair seated here has any objection, just to say thank you very much for confirming your question, sir. Honorable Minister.
Thank you so much, Mr. First Deputy Speaker. And through you, let me thank the honorable member from Zimba Southwest for his question, which is to ask my ministry what plans government has to complete the construction of Edingeni Rural Hospital, where works have stalled despite communities waiting for remaining wards. Mr. First Deputy Speaker, sir, my ministry is aware of the status of Edingeni Health Facility, which was earmarked for upgrading into a rural hospital alongside other facilities in Mzimba South, like Jenda, Bulala, and Eutini. Mr. First Deputy Speaker, sir, I would wish to clarify that construction works at Edingeni have not stalled. However, the existing infrastructure at the facility requires significant upgrading and expansion in order to meet the standards of a fully functional rural hospital. The current structures are not yet adequate to support the full range of services expected at that level of care to be provided at a community hospital, including inpatient wards, theater services, diagnostics, and staff accommodation. Mr. First Deputy Speaker, sir, my ministry remains committed to the progressive upgrading of Edingeni into a rural hospital. At present, priority has been placed on completing ongoing infrastructure development projects at Jenda and Eutini rural hospitals, where substantial investments have already been made and where infrastructure is at a more advanced stage. Nevertheless, Mr. First Deputy Speaker, Edingeni remains part of the ministry's integrated capital investment plan. My ministry is actively mobilizing resources to ensure that all earmarked facilities, including Edingeni, are eventually upgraded to provide comprehensive services to the communities they serve. In particular, the CDF will be leveraged to support such upgrades. Mr. First Deputy Speaker, sir, in the meantime, the ministry continues to support Edingeni Health Facility with essential health services, staffing, and medical supplies to ensure that the population continues to access care as infrastructure development progresses. Mr. First Deputy Speaker, once fully upgraded, Edingeni will significantly improve access to quality healthcare services, reduce referral distances, and contribute to improved health outcomes in Mzimba Southwest constituency. I thank you, Mr. First Deputy Speaker.
Thank you.